Understanding lung cancer, a journey from awareness to action. Good morning. Today we'll discuss on an important and growing health concern, lung cancer. So our journey will include its background, epidemiology, diagnostic approach, management strategy, newer therapeutic therapies, prognosis, and finally, how each of us, especially healthcare workers, can play a role in improving outcome. So first, background. Lung cancer arises from abnormal growth of cells in the lung tissues. It is broadly classified into non-small cell cancer, that is NSCLC, which is 85% cases, and small cell cancer SCLC, which is 50% lung cancer cases, and which is aggressive and having a bad prognosis. So major risk factors are tobacco smoke, that's a leading cause, 90% of the cases. Passive smoking, smoking done by other person who is in nearby. Occupational exposure like asbestosis, arsenic, diesel exhaust, air pollution, genetic susceptibility. Now, epidemiologically, globally lung cancer is the second most common cancer, but the leading cause of cancer death. According to Globocan 2020, 2.2 million new cases per year of lung cancer, out of which 1.8 million deaths. So let's talk what is the condition in our country, that is India. Among top 5 cancer in men, increasing in women due to rising tobacco use and air pollution. Late diagnosis is the common. 70% of the patients, they are diagnosed in the stage 3 and stage 4. So let's talk about the investigation and diagnostic assessment. Clinical suspicion, persistent cough, hemoptysis, significant weight loss, breathlessness, chest pain, hoarseness of voice, fatigue, and tiredness. So the initial workup, X-ray chest, CT thorax. The diagnostic confirmation is done by histopathology. It could be via bronchoscopy, CT guided biopsy, FNAC, immunohistochemistry to subtype the cancer. Staging workup, PET scan, PET CT scan, MRI brain if symptomatic or stage 3 or 4, mediastinoscopy in some cases, molecular profiling, especially in non-small scale small cell lung cancer, EGFR, ALK, ROS1, KRAS, BRAF, MET mutation, PDL1 expression, for immunotherapy. Management and treatment. Treatment is a stage based, means according to the stage 1, 2, 3, 4 and histology given. So the stage 1 or 2, which is localized, surgery, lobectomy, pneumectomy is preferred. Adjuvant chemotherapy or radiotherapy depending on lymph node involvement. Stage 3, multi-modality approach. Chemo, that is chemotherapy plus radiotherapy. Surgery in selected patients. Stage 4, advanced or metastasis. Systemic therapy, chemotherapy, targeted therapy, immunotherapy. Small cell lung cancer typically treated with chemotherapy plus radiotherapy. Limited stage small cell lung cancer, chemoradiation with curative intent. Extensive stage small cell lung cancer, palliative systemic therapy or treatment. Now let's talk about the newer treatment and advances. Targeted therapy, EGFR inhibitor, osimertinib, erlotinib, ALK inhibitors, alectinib, loraglutide, ROS1, MET, RET directed drug. Now immunotherapy, checkpoint inhibitor, PD1 or PD1L, PDL1, nivolumab, pembrolizumab, acetozolizumab, used in advanced non-small cell lung cancer based on PDL1 expression. Liquid biopsy and circulating tumor DNA emerging too. Personalized medicine therapy based on molecular profile. So now let's talk about the prognosis. 5-year survival, early stage non-small cell lung cancer 60 to 70%. Stage 3 20%. Stage 4 less than 10%. Now small cell lung cancer has poorer prognosis due to rapid progress. Prognosis improving with early detection and targeted therapy. So now let's talk about the way forward. Early detection through low dose CT screening for high risk individuals, for example heavy smoker whose age is 50 to 80 years. Public awareness of early symptoms. Tobacco cessation is the key. Environmental control, reduce indoor or outdoor pollution, molecular testing access in rural setting, integration of palliative care and support, mental health support. Now, social message to the community and healthcare workers. Community healthcare workers are the bridge between medical services and the public. You can identify people at risk like smoker, occupational exposure, refer patient early for persistent cough or hemoptysis, educate about tobacco cessation, screening and symptom recognition, help patient navigate care and support. Lung cancer is not just a smoker's disease, it is a public health issue that we can tackle together through awareness, early action and empathy. So let's conclude with, let us commit ourselves to improving lung cancer outcome through knowledge, early detection and compassionate care. Thank you.